The following educational video was created in collaboration with the Faculty of Biomedical Engineering of the Czech Technical University in Prague and the first surgical clinic of the General University Hospital. Other departments and clinics can also utilize the central sterilization department. Sterilization of materials is carried out based on a request form, which specifies the quantity and type of materials along with the required sterilization levels. Once the surgical operation is completed, the instruments and materials used are checked and recounted. Contaminated tools are placed in a stainless steel container and the used sieve is prepared for transport to the sterilization department. Used tools must be entirely covered when leaving the operating rooms. A disinfectant solution is poured into the stainless steel container for decontaminating contaminated instruments. Disinfectants are regularly alternated, and during a specific period, the same solution in the prescribed concentration is always used in the operating rooms and the sterilization department. The type, usage time, and dilution of the disinfectant follow the disinfection protocol. The instruments prepared in this way are transported by the surgical nurse to the so-called dirty elevator. A bell notifies the sterilization department staff that there are used tools in the elevator. After being retrieved by the sterilization department staff, the instruments are again submerged in the same disinfectant solution and recounted. Any discrepancies in the number of instruments are immediately reported to the surgical team. Electronics and outlets are protected from water, disinfected by wiping and sterilized with gas. Once the exposure time is over, the tools are taken out, set on a sieve, and loaded into the washer. Next comes the drying process. All processes are monitored and have documented results. There are several types of washers, and instruments are placed in them according to their shape and size. Each surgical operation has its unique sieve, which consists of the instruments and materials required for the specific surgical procedure being performed. Each sieve comes with a list of tools, detailing their exact numbers and featuring a photo. Instruments are oiled before being placed in the sieve. Locks are lubricated to maintain functionality and extend the lifespan of the tools. On the workbench, the individual sieves are being set and stored in containers. The container is labeled with the exact identification of the staff, including who washed the instruments, who sterilized them, the expiration and usability time of the sieve, when it was sterilized, and the name of the sieve. The finished sieve is sealed with a seal. The seal guarantees the sterility, completeness, and integrity of the prepared sieve. Light adapters and small sieves along with other materials are packed into sterilization pouches. Before the surgical procedure, this material is prepared on an auxiliary sterile table. The bags are labeled with identifiers. After sterilization, the identifier changes color, ensuring the sterilization process was completed. The identification label also includes the initials of the staff member who packed and pre-sterilized the material, the filling date, and the expiration date of the material. The envelope method is used for packaging and sterilizing surgical meshes made of non-woven fabric and crepe paper. The package sieve must be sealed so that all seams are covered with tape, preventing air pockets. This prepared sieve is marked for clear visibility of the contents and has identification labels and thermal indicators attached. These labels are sealed on the front for easy visual inspection when the material is stored in cabinets. The prepared material is then transported on a cart from the non-sterile zone to the autoclave. The autoclave has doors on both sides. Once the sterilization process is finished, the materials are moved to the sterile zone. When taking it out, a visual check of the packaging's integrity is conducted. The prepared materials are then transported back to the operating rooms via a clean elevator that connects directly to the sterile material storage. Contaminated and sterile materials never come into contact. Before the surgical procedure, the operating nurse removes the sieve from the instruments to the auxiliary sterile table and checks the number of gauze materials and tools. The sterilization process and the use of individual materials are recorded, monitored, and the results are entered into the patient's medical documentation. The sterile materials are stored in the operating room support areas or in lockable cabinets found in each department to ensure cleanliness and safety. Newly sterilized materials are always placed at the back, with older ones being moved to the front.